Hello there, it's Luke, and this is the second Anything But COVID ABC bite-sized tutorial. And you'll recall from about a week ago, I set this little conundrum for you. There's an excellent illustration here showing a group of clinical signs that you might see in somebody following trauma. And briefly, you can see on here we have what we would refer to as raccoon eyes, so bruising around the eyes. There's leakage of CSF from the nose, so rhinorrhoea, CSF rhinorrhoea. Leaking of CSF from the ears, CSF otorrhoea. The battle sign, which is bruising behind the ear. Hemotympanum, which is blood collecting behind the tympanic membrane within the ear, and obviously a big bruise on the head. And you may have already realised that this is suggestive of a base of skull fracture. Now, here's some of the terminology for you. So, an open skull fracture is where you have the broken bone is sort of protruding through the soft tissue, through the skin, and a depressed skull fracture is where you have the bone fragments being sort of pushed inwards by the fracture. But we're going to talk about base of skull fracture, and this generally relates to something referred to as high energy trauma. So that begs the question, what's high energy trauma? Well, this is from NICE Guideline 176, and they've defined a high energy trauma as a fall from greater than 1 metre, a fall trauma where there's an axial load injury to the head. So if you imagine your head is coming down and sort of landing like this, perhaps from a sort of diving type position, or a fall from a height. Of course, road traffic accidents or road traffic collisions rather, and sort of any kind of extreme sport injury involving a head injury, such as a collision with a bicycle. Now, this is a model of the base of the skull, and those of you that have done previous training in neurosurgery or neurology or sort of neuroanatomy will recognise up here we've got something that looks very much like the circle of Willis, because that's what it is. And this is the arterial blood supply to the brain itself. We've got the vertebral arteries coming up here, and these sort of little white areas that you can see, those are where the cranial nerves sort of leave the brain and the brain stem to go to their respective sensory or motor sites. Now, I wouldn't get too hung up on trying to memorize too much of the sort of landmarks, the bony landmarks here, but in this diagram we have, so this is the anterior towards the front, this is posterior towards the back, and essentially it shows the main bones we have here. So the skull, or certainly the base of the skull, is made up of the frontal bone, the sphenoid. On either side you have the temporal bones, and then we have the occipital bone at the back. And then if we were to have the whole skull pictured here, or certainly in this little diagram down at the bottom, you can just begin to see the parietal sections of the skull which sort of wrap around like this. Now, going back to our ABC diagram and looking at the various clinical signs, we'll go through them one by one. Okay, so raccoon eyes, or more technically, periorbital ecchymosis. So ecchymosis is just another word for bruise, and there needn't necessarily be any other trauma about the face, but this sort of very distinctive bruising around the eyes. And this is generally associated with injuries towards the front, towards the anterior of the base of skull. So, for instance, and here's a bit of terminology for you. So, anterior towards the front, fossa is any kind of generally bony sort of bowl-shaped structure. So within the base of skull itself, we've got 3 fossa formed by the bones. So there's the anterior fossa towards the front, where made up by the sort of frontal bone, that sphenoid bone, where your frontal lobe sits. And we can see on our diagram again yeah, you can see the sort of frontal bone there and the ethmoid bone and sphenoid making up that fossa, which is where the frontal lobe sits. So any fracture to that area will likely cause bruising around the eye, that sort of periorbital ecchymosis or raccoon eyes. Now, you may or may not have seen this if you've looked after any trauma patients. There may be sort of leakage from the nose or the ear. So from the ear, otorrhoea, from the nose, rhinorrhoea, and you may get this sort of quite distinctive staining on sort of bed sheets or pillows, for instance, what we call the halo sign. So you can see that sort of it separates out into sort of circles like a halo. And that's where you have blood and potentially CSF dripping or sort of appearing on sort of bed sheets or a piece of paper, and you can see how they sort of form this sort of distinctive halo pattern. And again, just to clarify some technical terms, so otorrhoea means discharge, which is sort of a more sort of umbrella term, if you like. Orrhagia, so a word ending in orrhagia, generally means loss of blood. However, this is to be interpreted with a little bit of caution, because any sort of clear fluid, such as tears, mixed with blood, when sort of dropped onto a piece of paper or a bit of linen, may form this same pattern. So it may not necessarily be CSF that you're seeing, but it's worth having a suspicion that it could be CSF, especially in the context of head trauma. So the battle sign. So this is bruising behind the ear. So post-auricular, so auricular is generally referring to the ear. Ecchymosis again, bruising, or mastoid. So you've got this bony process down here called your mastoid. And again, bruising around there. And that's what we refer to as the battle sign. And that is often associated with a fracture around the middle fossa. And you'll recall from our sort of more complicated looking diagram, generally the sort of temporal bone, which is the one that you can see in orange, or the sort of sphenoid bone just in front of that. If there's a fracture around there, you may see that distinctive bruising behind the ear. Now, what you can see here is a view through an otoscope. So that's the piece of equipment we use for looking inside people's sort of auditory or ear canals. And this is what a healthy looking view would give you. So there's the tympanic membrane that you can see, and here's the sort of auditory canal. And I wouldn't focus too much on those sort of more technical terms there. Now, this is a somewhat more colourful picture of the same thing, but if you can see that sort of circle just off centre there is much darker, sort of almost purpley, sort of, it looks like a sort of bruise colour, and that's blood that's sat behind the tympanic membrane, so blood in your middle ear, and this is referred to as hemotympanum. And again, if you've got a base of skull fracture, especially if it's in that sort of middle fossa, so the temporal bone or sphenoid bone, you may have blood that sort of comes down a tract and sits behind the tympanic membrane. Now, it's worth saying that it's worth learning these signs. However, just because somebody has some or all of these signs, I mean, it would be rare that they have all of them, but some or all of these signs, actually only about a third of people that have any of these signs will actually have a confirmed base of skull fracture. And essentially, that I think the key learning point is that anybody that's been involved in a high energy trauma, or where the sort of story is unclear, but they appear to have any of these signs, then they should have a CT of their head, because it may be they have a base of skull fracture or some other significant intracranial injury. And what's worth saying that is absence of these signs doesn't necessarily rule out a base of skull fracture either. So any of these clinical signs are to be interpreted with caution. Okay, now following on from having a base of skull fracture, clearly there's a break in the body's natural defense mechanisms. So for instance, the dura and the subarachnoid layer presumably are are damaged or disrupted for you to have CSF leaking from either your nose or your ear. This can predispose somebody to developing meningitis. And similarly, pneumocephalus, so pneumo meaning air, cephalus meaning the sort of skull and around the brain, so air in and around the brain, or postural headaches when you stand up. It gets very painful headache, sort of characteristic of sort of high or low, actually, intracranial pressure. These are the references that we've used to put this talk together, and that's the end of our ABC session for this week. Thank you very much for listening.